Is it a mental health crisis? I don't know, but tune into this episode to learn about mental health and the evolution of mental health in 2024, almost 2025. As we're at this quarter turn of the 2000s, here we are, and really looking at teen anxiety and depression. It's something that we continue to see this increase. And so in this episode, we're going to delve into the rise of anxiety and depression among teenagers. Whether you believe it or not, it's there. Many of us just say, toughen up, but we're going to look at exploring some recent studies that highlight the prevalence and persistence of these mental health challenges. We discussed contributing factors and the impact of COVID-19. You cannot forget the impact that the pandemic has had, and there are unique pressures faced by today's youth. And lastly, we'll kind of finish up with diving into some solutions, because as you know, on Air with Dr. Pete, I am here to kind of think about and present some solutions. And that's what we do in cognitive behavioral therapy. So many of you maybe heard of CBT. In cognitive and behavioral therapy, our goal is to minimize symptoms, to find ways to manage what's there. And so I know a lot of the folks of my generation, when we think of anxiety and depression, all of us have said or heard someone say, just toughen up. And, there's some truth to that. So I'm not going to sit here and say this bleeding heart of like, oh, this is really an issue. And, these are things that people have dealt with since the beginning of time. And the one thing that we haven't dealt with since the beginning of time is the internet. And I sound old saying that because I don't know that anyone really refers to it that way, but the World Wide Web is new. And it's still new because our brains, this is the first generation kind of born into it. If remember, you've heard me say that I think it was Barack Obama who had the first Twitter account as a president of the United States. So this is not that long ago that we're using social media in the way that we are. And so nearly 75% of teenagers experience significant anxiety and depression by the age of 18. So this came out of Murdoch's Children's Research Institute study. It's in Melbourne, but we have all this kind of research here in the United States as well. And so I think it's important to look at the international aspect of it, because it's not just something that's in America. One thing, they'll think that gun violence, for example, just in America. All the stuff that you look at today is related. And so when we talk about anxiety and depression for the adolescents, this is leading to some of the maladaptive behavior. So the things, there's not a direct line that says that leads to gun violence or school shootings. I think I was reading an article that I think in 2024 there were 300 and something school shootings. I mean, it's pretty pathetic that I don't have that number right in front of me, but the fact that we're talking in the hundreds of school shootings just in the United States alone, is it somehow correlated? And what we find in any kind of mental health or behavioral research is that pretty much you always find correlation. So correlation does not mean causation. And let me just break that down for you. Correlation means that there is some kind of relationship. So whether positive or negative, if it's a positive correlation, means as one goes up, the other goes up. If it's negative, as one goes up, the other goes down. I don't know, one would suggest that the correlation here is that as anxiety and depression goes up, maladaptive behavior goes up. So there's a positive correlation there. So we're not saying that it directly leads to all of this, but maladaptive behaviors could be anything. It could be fighting in school. It could be missing class or cutting class. And, those are behaviors that have existed forever. I mean, I had classmates that were cutting or missing class. I don't think I did, but I was probably too afraid of getting in trouble. I do have a little bit of that in me where I do not like to get in trouble. And no one really, well, some people do like it, but I really don't like it. But within this study, there is a higher prevalence of depression and anxiety in girls. It's 84% compared to 61% in boys. What I'll say to that is because boys are not going to express it in the same kind of way. Girls' language develops sooner. And so we know that from developmental psychology, that girls' language when compared to boys, will develop at a higher rate. And so they're able to express themselves more effectively. And this is going to be the case with anxiety, depression, or any other types of emotions or challenges that they're having. So what we find in, say, psychotherapy literature is that the ability to talk about things decreases maladaptive behavior. So if the girls are able to speak about it more, they're going to perhaps have less maladaptive behavior, but at least talking about this prevalence of them experiencing it at a higher level. The boys are still experiencing it. I'm going to say, obviously 61%, it's likely higher because what I find is boys will minimize more. Boys feel like they're not allowed to. It's, you're weak if you do. So there's lots of different contributing factors that play into these emotions. Of course, puberty. So if you think about developmentally, puberty, there is an uptick in all these hormones. And so the hormones will lead to an imbalance of lots of different, neurotransmitters, and that will create a lot of high intensity. And so you'll see things like girls being mean to each other and, boys fighting. Of course, the sexual drives, begin to kick in, masturbating, things like that. So that is going to play into this, especially because there's less privacy. So people were able to, my friends, we always talk about diddling. I don't know, depending on what generation you're from, maybe you heard of diddling. But maybe they were behind the couch diddling. That's one of my teammates we would talk about. And that exploration is maybe a little bit more challenging to do today because there's less privacy, whether it's because people are living on top of each other, but certainly because of social media. High school kind of leads to that. You cannot talk about adolescent mental health without acknowledging COVID-19 pandemic, because this is this was a once in a century, pandemic that, I don't know, when I talk to colleagues and I just think about, holy cow, like we went through this, I remember being in arenas where it was just me, and providers with the team, like an empty arena playing games, whether football, basketball, wearing masks. I was doing therapy in all different kinds of places because obviously people were impacted by this. And so one of the good things was that it brought us to do therapy virtually. In my practice, we were doing it virtually for quite some time because we work with high performers and especially with athletes that are constantly traveling. But it forced the rest of the world to go into this kind of virtual nature, which was really helpful. I remember my first annual physical post-COVID-19. It was really efficient. I was able to fill out all the paperwork, get everything done, wait in my car, and then, we were texted once the doctor was ready, walked up, walked in, got my, physical and left. And I hope that we carry on some of those. But it's also the COVID-19 pandemic, so I start with the positives, but there's also been negatives. And so for adolescents, certainly, and we see that there's just this, social anxiety. And so, again, my generation might be saying, oh, suck it up, Joe, social anxiety, you're going to feel uncomfortable. And some truth to that. A pandemic has really kind of forced people into this discomfort where they're more comfortable on a device when compared to in person. We can't talk about this without social media. So that, I think, is the biggest thing for you to think about. The internet, World Wide Web, and social media. We did not have that. We did not have TikTok, Snapchat. These are things that people, it's the only way that they communicate. And many adolescents, this is where they're getting their information. It's funny, some of my athletes recently be like, oh, Dr. Peter, so you're on TikTok. And they say it with a curiosity because they're like, you're old to be on that. But, trying to reach the audience and kind of educate. And that's what we're, trying to do here. Family dynamics, over 50% of families divorce. And so that's become normal in a way, right? Because that's the majority. And so that's going to still impact people. They're depending on sort of, again, because there's less secrecy. So if there was like infidelity or some kind of straying, perhaps then the whole family or the children know, and that creates a lot of, stress in that. And then just broader societal pressures. So just societally thinking about how polarized we are politically, certainly here in the United States. But the good news is, and I say good news because sometimes I feel like defending sort of the United States perspective or democracy, but you do see this across the globe where there is this sort of pull of, conservative versus liberalism. And I really encourage you to like look at that dialectic because it really creates a lot of suffering. Creates a lot of tension, and unnecessarily, because when you look at things in that dialectic of right and wrong, that's when you get stuck in it. trying to find the middle path is really the key in that. So those societal pressures, but see, those of my generation, I would expect for you to have arrived to that, to understand that there is a middle path. Adolescents are unable to, because developmentally their brain is so concrete that it's still only seeing it in black and white. Another factor to this is how this is also kind of trickling down from the parents. So there's a lot of workplace mental health challenges. And so if the parents are working in an environment where they're unhappy or unwell, that is going to trickle down, to the family. And so something that will then impact their financial and all the other aspects of well-being, intellectual, social, environmental, recreational. Are we staying outside until the lights go on anymore? We're not. We're gaming. A lot of my athletes and clients talk about, playing the game. And I'm always like, which game? But it's really just whatever, it's PS5 or whatever it is that they're playing. And then, back in my day, you would say, oh, Mario Brothers or whatever it was. I don't even know, because I was telling a client recently that my family, we were never big into gaming. Both my brothers, all of us were active in sport, and both my brothers played baseball, and I eventually swam. They like to joke to say that I never really played baseball because I wasn't as good as them, but then I took my own sport on and did okay. So we were out a lot, and so none of us were really big into gaming or running. So that's not related by any means, but we are. That was not something that we were there. So there are suggestions, experts and about how to kind of manage this. What I said to you on the intro is thinking about how do we do this? And so, the roles of communities, schools, and families, this is critical for mental health. So really thinking about Bronfenbrenner has this sort of ecological system where it's everything's, internally within, like the family, and then the neighborhood, and then the community, and kind of thinking each stage up. And really all of that is going, to have to be something that is considered, as you're looking at ways that we can combat this. I guess you call it like it's an endemic, or I've never, in choosing to go into psychology, I never would have thought that this is that I would be so, and this is not narcissistic, but important or so relied upon. I don't feel important at all, but in many of my roles, there's just such an emphasis on mental health today. And I will be the first to say that sometimes I think it's a little bit too much. And so hopefully you're not insulted by that, but maybe you understand that that's also part of middle path. I suffered, as an adolescent. I had the challenges with this. To be clear, anxiety and depression are not, diagnoses in and of themselves. They embody symptoms that kind of would contribute to another diagnosis, like major depressive disorder, adjustment disorder, OCD, phobias. Those are sort of things that we see. So anxiety and depression are just some of the basic emotions, and so you want to recognize and build a relationship with it. So that's where the mindfulness stuff comes in. But there are other, preventative measures rather than just traditional clinical care, because for adolescents, you don't. Some do need, psychopharmacological intervention, so some kind of medicine. But as a behaviorist, you want to start first behaviorally to think about ways that might work. We need to increase funding for mental health services, certainly. We need greater accountability for, say, the entire system. So, all the way from the government, down to the family. And then everything in between, meaning, churches, community-based, facilities, churches, I think I just said that. So all those types of things, schools, those are pivotal roles in supporting young people's mental health. But, I appreciate you tuning in today. It is crucial to remember that these open conversations about mental health, they will lead to better outcomes. And so if you're noticing yourself judging this episode or judging the conversations around, say, anxiety and depression, slow down and just, try and take a non-judgmental perspective on that. So if you or someone is struggling, don't hesitate to seek support. 988 is a number you can call, in the United States, for any kind of suicidality or just to kind of seek, some recommendations. But also lots of community mental health centers, located to you that would be able to kind of help point you in the direction of some of the resources and taking that vital step. So thanks again for tuning in. I'm Dr. Pete Economo. This is On Air with Dr. Pete. I will see you next week. And until then, spread a little kindness and stay well.